Please welcome Dr. Marjorie Dixon. Always a joy to have her here with us in studio. And you know, it is so important, all of these different issues when it comes to women's health. And I think it's great that we can talk about it here because we do get the viewer questions about a lot of these things.
Yeah.
We want to talk a little bit about uterine bleeding.
Yes.
And what constitutes normal, because this is something that a lot of women deal with.
Right.
And they might not be aware of what's okay and what's not okay.
Right, so this is something that continually astonishes me because I have conversations with my patients. I'm a fertility specialist, but I also do gynecology. And when they come in, I have to ask people all kinds of questions about their periods.
Yeah.
How often do they come? Are they heavy or not? What's your usual number of days of bleeding? Is there any spotting in between? And I realize that women accept nonsense. Women are tough. We're tough. It's like we know we get our periods. It's part of being women. We are women, hear us roar. So if we bleed a ton or if we have really irregular periods, we accept a lot as normal, which is completely abnormal.
Really?
So for example, I had a patient the other day who was telling me, I was asking, how many days of bleeding do you have? Well, it used to be that I had 3 to 5 days of bleeding, but now I have like 8 days of bleeding, and sometimes I miss work and I get a little bit dizzy, but I'm taking some iron pills because my doctor says I'm anemic. I'm like, wait, 8 days of bleeding? And then how heavy is it? Well, at night I have to set my alarm so I can actually wake up because otherwise I'll soak my sheets.
Oh, wow. Yeah, that's a problem.
That's a problem.
We are tough, though, right?
We're tough, and
we
then,
just think, let me just soldier through it. I'm sure it's fine. Because the other thing we hear is that there are going to be discrepancies in all of our cycles. All of our cycles are different, so everything's kind of normal.
Exactly.
But that's not true.
Well, there is a range of normal, and I think that's what's important. And we've talked about menstruation before and why it happens, but then to really be able to delineate when you need to talk about it and what can be done about it, because women also say, I don't want surgery, or I don't want to take hormones. So I'm just not going to talk to anybody about it. But there are other options. So the main thing that I see that people talk about is volume of bleeding. So volume is quantity, so how much. So the average menstrual, do you know how much it should be about?
I have no idea.
All right, so this is not the makeup, but just the volume, the quantity. So it should be about this much of bleeding over a 5 to 8 day period.
Over a 5 to 8 day period.
Somewhere between that and this much. Okay, so that's 80 milliliters.
Okay.
Doesn't seem like that much, right?
No, and that would be really hard to quantify, too.
It's hard to quantify. So we ask people, how often are you changing your pads? But when I tell women, it's about 80 milliliters. Anything more than that, 100 milliliters, like a big cup, that's too much bleeding.
Okay, something's wrong.
Something is wrong. So that is something that can be brought up by your doctor. But then it's not just brought up to your doctor. But it's not just volume. It's also how frequently it happens. Some women get periods less than every 21 days. That's not normal.
Okay.
Or more than every 35 days. That's not normal. So something can be done for it. And that's what needs to be discussed with your physician.
What are the sorts of things that can be done about that? Or what might that be indicative of if you're having too much bleeding?
So the first thing I should specify is it depends on when you are in your menstrual lifespan. So if it is between the time where you get your first period and then about age 41, it's mainly probably due to issues around ovulation, and people have weird ovulation, weird cycles. So that is something. Early on, if women are getting their period, so you have a teenage daughter who's gotten her period and she's flooding and then she doesn't get a period for 4 months, that is not that unusual because that's usually the immaturity of what we call the hypothalamic pituitary axis. So as your body is starting to communicate, the hormones in your brain are talking to the hormones in your pituitary gland, to your ovaries, it's not always perfect. So that's more normal to have variations, but that also can be helped. Okay? And then after age 41, 42, having irregular bleeding and cycles that come and go is somewhat normal in the perimenopausal period, but it also needs to be investigated because it can be heralding something that's a little more insidious, like cancer.
Okay.
So that is something, especially if you're over 40 and you're having strange bleeding, lots of bleeding, less bleeding than you used to have, or spotting in between periods, that needs to be brought up to your physician. Don't accept it as normal perimenopause, because it can be, but it may also not be.
Don't come to your own conclusions then. Check that out if it's not something you're used to.
And women will believe anything if they talk to their friends or their aunts or sisters.
Yeah.
Oh, my aunt had that irregular bleeding. You're fine, girl. It's just your perimenopause. But it might not be. So that's why when you talk to your physician and they know where you are in your reproductive lifespan, they know what to do. So I think it's important for me to say that it doesn't necessarily have to be hormones, because the main thing I hear from people is like, I don't want to take hormones.
Right.
I don't like the idea of hormones. I don't want to disrupt my natural system.
Yes.
Which is not, I mean, I understand that. You want to see your period, but you don't also need to be at risk of developing anemia. And missing time, it interferes with your daily living. If it makes you miss work, if it makes you have to I had someone tell me that she puts 2 Super Plus pads in plus a panty liner,
Yeah.
and she has to change that every 3 hours for her first 3 days of her period. That's not normal.
How do you fix that, though? Or how do you help that?
First, the physician has to figure out why it's happening.
Okay.
So there are kind of the Federation, the International Federation of Gynecologists and Obstetricians actually set out a new nomenclature so that doctors can know how to describe abnormal uterine bleeding and then to divide it into categories as either something that's structural, so there's something in the uterus that could be causing the bleeding, a polyp, adenomyosis, fibroid, and then on the other side, it could be a functional problem. Like, for example, if someone had very heavy periods right as they got their period and they have always been incredibly heavy, but they haven't figured it out, it could herald that they have a familial blood clotting problem.
Okay.
And that needs to be worked up. And then when you figure out what's at the root of the problem, then you can fix it and improve someone's life.
So what do? Do you just keep track then every month to see that there's regularity?
Yeah,
Is that how you know that something?
Yeah, so what's the pattern of
Is
your
that a whack?
period? Has something happened that has changed it acutely or dramatically over a period of time? So you had regular periods and then all of a sudden it got really heavy at age 34.
Yeah.
And you just accepted that that was what it was going to be from now on.
Right.
So was there a period where it changed, or is it really unpredictable? That's not normal.
Yeah.
Has it changed from what your regular pattern was?
Okay.
Right? Because if you have a fibroid, sometimes if you need a surgery, it's not a surgery where you get cut open. We can go in through the vagina and the cervix and do minimally invasive surgery.
Right.
And patients don't have to miss any time from work, really, 1 day.
So you don't know how little or how much it's going to take.
Yes.
The bottom line is get it checked out.
Yes.
And it doesn't always mean it's going to be surgery, right?
No, absolutely
And even
not.
if you still want to have children, there might be a way to fix this without ever
Absolutely.
disrupting any of that reproductive
We
issues.
fix the problem, get to the bottom of it, and
Right.
improve your life dramatically. So talk
Okay.
to your doctor about it.
So now all the men in the audience and the men at home can turn the volume back up and you can take your hands off your ears. Thank you, Dr.
You're
Dixon.
welcome.
Let's go to break. More coming up. They were like this. La, 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 la.